The Antimicrobial MicroClave is the latest antimicrobial connector by ICU Medical. MicroClave is built on the same internal fluid path technology as the original clave. The technology and characteristics of the MicroClave make it the least likely to transmit bacteria over any other brand and meets the additional demands of healthcare today with neutral displacement and saline flush. The Antimicrobial MicroClave now has the added feature of an antimicrobial additive to enhance the dedicated internal fluid path and further reduce the risk of bacterial ingress into the catheter. Ionic silver has been infused into all fluid path contact components, which includes the internal cannula and split septum seal. The Antimicrobial MicroClave is a reversed split septum technology made up of 3 components. An internal blunt cannula with 2 fluid path windows makes up the dedicated internal fluid path. The same split septum compression seal that is used in the original clave, which covers and seals the fluid path, and the new low-profile housing, which is 32% smaller than the original clave, completes the manufactured product. The antimicrobial ionic silver is infused during the molding process, which provides an even and continuous distribution of silver ions throughout the components. The antimicrobial MicroClave provides greater than a 4-log bacterial kill rate for a continuous 96-hour use life. This method of manufacturing eliminates the risk of the antimicrobial additive scraping or wearing away over time and repeated use. The antimicrobial clave was proven effective with 2-gram negative and 4-gram positive bacterial strains. When the MicroClave is disinfected using a swabbing technique, microorganisms are removed from the access site of the split septum. The antimicrobial agent adds extra protection against bacterial contamination that may come into contact with the swabbing surface. As the access lure contacts the sterile silicone surface and begins to compress the septum, a dynamic seal is created, and the internal blunt cannula begins to pass through the split septum. Not until the silicone is compressed and the windows of the cannula become exposed in the internal diameter of the access lure is the fluid path accessed. This creates the dedicated internal fluid path, where at no point does the exterior of the access lure, reversed split septum, or housing come in contact with the fluid path. The internal cannula, which houses the fluid path, also contains the antimicrobial additive. As fluid enters the clave, it becomes exposed, along with any bacteria, to the silver ions. When the access lure is removed, the septum returns to cover the cannula and closes the fluid path once again. The internal dead space of the MicroClave is 4 microliters, which helps to provide the neutral displacement upon disconnect. Neutral displacement means that blood backflow into the catheter upon disconnect is minimized. This neutral displacement feature allows the clinician to use the MicroClave without any clamping protocol, which eliminates the risk of error that can occur when using either negative or positive displacement connectors. The MicroClave also incorporates a saline flush protocol, which provides a cost savings to the healthcare provider and allows the MicroClave to be used on all vascular access devices. The new antimicrobial additive enhances what is currently the best available connector technology. With 99.99% effectiveness, the antimicrobial clave will further protect your patient from bacterial ingress through the connector. MicroClave Neutral Connector combines technology and proven infection control features in conjunction with the antimicrobial silver additive, which is a proven enhanced barrier against bacterial contamination. For further information, please contact ICU Medical Inc. at 949-366-2183 or online at www.icumed.com.